Welcome to the recorded version of Loneliness and Aging, the Other Epidemic, part of the Family Caregiver Support webinar series brought to you by the American Society of Aging and a generous sponsorship from Homestead Senior Care.
Okay, we have two presenters joining us here this morning. Lakelyn Hogan is a gerontologist and caregiver advocate for Homestead Senior Care and a doctoral candidate at the University of Nebraska, Omaha, where she is studying social gerontology. April Ibarra is the Strategic Accounts Manager at Homestead Senior Care and supports the organization's mission through collaborating and creating partnerships that develop impactful relationships for the Homestead Network. And with that, I'm going to turn the presentation here over to Lakelyn and April. Welcome.
Thank you so much, Steve. Hello, everyone. I'm glad that you're able to join us amongst your busy schedules. In this time of social distancing, we know that staying connected has never been more important. It's really important, particularly for older adults, because they're at a higher risk of isolation and loneliness. And this has been the case far before COVID-19 ever was part of our daily vernacular and before COVID interrupted our daily lives. So it's really important for us as professionals in the aging space and also for family caregivers to understand the significant implications of isolation and loneliness because we do find that it is becoming the other epidemic. I've also heard people refer to it as the silent pandemic that's really sweeping the nation and the world. Research shows us that loneliness can have considerable health implications, worse than that of obesity and alcoholism and even smoking 15 cigarettes in a day. So again, these implications of isolation and loneliness are real and they impact those at highest risk, which are older adults. And so today we're going to dive deeper into that topic. So I'm really glad again that you have joined us. And my colleague April, she'll jump in here in a little bit and I'm excited for you to hear from her as well. But before we get started, I thought I'd just go over our objectives quickly here on the next slide. So my hope is that by the end of the hour, you'll have a better understanding of isolation and loneliness. There is a difference between the two. I also hope that you'll learn more about the impacts that isolation and loneliness can have on older adults, and also be able to identify warning signs of isolation and failing health in the older adults that you serve. And then finally, we want to equip you with resources and supports for you as a professional and ones that you can pass on to family caregivers so that they can hopefully help reduce the risk of isolation and loneliness in their loved ones. So before I dive too much deeper, I do want to make note that isolation and loneliness is not a normal part of the aging process. Of course, our age, as we get older, it can increase our risk of isolation and loneliness, but it is not normal. And it really is something that we as professionals and family caregivers need to be keenly aware of, because there are some things that we can do about it. We can be proactive and reach out to our loved ones to reduce their isolation and loneliness. So again, it's not part of normal aging, but it is becoming ever more prevalent, especially because we're now all social distancing. COVID-19 has really interrupted our daily lives. We're not able to be physically present a lot of times with our loved ones, our aging relatives. And so isolation and loneliness is a real concern for the aging population and really for all of us in general right now. And society and the media tends to use the two terms isolation and loneliness interchangeably. However, they do have different meanings. So when we look at these two, isolation is an objective term and loneliness is more of a subjective term. So when we talk about social isolation, it arises when a person does not have enough people to interact with. So it's objective. The numbers don't equate for them. They don't have as many people that they're in contact with. So this term is more measurable. And loneliness, on the other hand, is our experience of distress over not having enough social relationships or not enough contact with people from our own perspective. So while the two concepts are often related, those that lack, people in their lives where they have social contact with, they're more likely to be lonely. But we do find that older adults can be surrounded by people and still feel lonely. For example, if they're living in a senior living community, they might be physically surrounded by people, but they still might feel lonely. Or a husband and wife might live together in their advancing age. So they physically have another person to connect with, but they still might feel lonely. So we do need to keep this in mind, that they are a little bit different, but again, we do tend to refer to them kind of interchangeably. But we also know that there are different types of loneliness. There's emotional loneliness and social loneliness. Emotional loneliness is felt when we miss the companionship of one particular person, often a spouse, a sibling, or a best friend. And social loneliness is experienced when we lack a wider social network or group of friends. And loneliness, we know, is kind of a transient feeling that can come and go. It can be situational. For example, it can happen on certain days of the week, maybe during the weekday, maybe their family's not as available to connect, so they might feel lonely during the week, but really connected with others on the weekends, or vice versa. And then sometimes that feeling can come around holidays or around the anniversary of a death of a loved one, that sort of thing. And loneliness can also be chronic, which could be something that a person feels most of the time or all of the time. So we are learning more and more about these two terms. And in today's day and age of social distancing, we know that this again puts older adults at higher risk of isolation and of loneliness. However, there are still ways we can stay socially connected and engaged. I heard somebody say recently, the term is called social distancing, but it should really be physical distancing, because we can be physically distant but still socially connected. And that really should be our goal with the older people that we work with and our older adult loved ones. So let's take a look at just the prevalence. And again, these numbers are pre-COVID-19. We just have a limited amount of data right now, and I'm sure in the coming weeks and months and years, we'll learn a lot more about how isolation and loneliness, the prevalence of it, has changed throughout this period of COVID-19 and social distancing. But the prevalence that we know about pre-COVID-19, this comes from a report by the Kaiser Family Foundation. They found that 22% of adults in the U.S. say that they often or always feel lonely. They feel that they lack companionship, they feel left out, they feel isolated from others. 22%. That is pretty significant. And 1 in 20 say that their loneliness is a major problem for them. Among those who are most likely to report being lonely or isolated include people who say that they have very few confidants. They don't have a lot of people to talk with. They also have a more likelihood of mental health conditions, chronic illnesses, disability, people who are lower income, who are single, divorced, widowed, or separated. So those folks tend to report that they have a problem with loneliness more frequently. And then according to a Cigna report, half of Americans report feeling sometimes or always alone. And so that, again, half of Americans feel this feeling at some point. And I'm sure right now, I've felt it. I don't know about the rest of you, but I've felt this loneliness because we're not able to get out and engage on a regular basis. So when we kind of pare that down and look specifically at the older adult population, some studies have found up to 43% of seniors feel isolated, or feel lonely on a regular basis. So these statistics to me are very staggering, and it signifies that there is a real problem with this. There was a study, kind of a more of a survey that went out by Us Against Alzheimer's recently, and they were asking individuals who are living with Alzheimer's disease, their caregivers, and those kind of in the space about their experience with COVID. And 57% of those respondents said that they feel more isolated because of this pandemic. So we do know that this pandemic, social distancing really is hiking the prevalence up. And, it really is kind of giving us all a kind of a small glimpse into the world of an older adult who might have had this loneliness and isolation far before, again, COVID-19 was ever a reality for us all. So maybe, hopefully, I'm taking away more empathy and understanding of what they might be going through. And I hope that this helps us all as a society become more creative on the solutions that we find. But as I mentioned earlier, isolation and loneliness can put an older adult at risk for health implications. And there are also risk factors that can put a person at higher risk. So I'm going to go over those risk factors first, and then I'll touch on the health implications. So there's multiple categories for that kind of make up some potential risk factors for isolation and loneliness. First, living alone. We know that older adults prefer a lot of times to age in place in the comfort of their own home. And while this can be great for feelings of safety and having those good memories around them, a familiarity with their neighborhood, there's a lot of benefits to remaining in your own home. But that means a lot of older adults are also living at home alone, and this can put them at an increased risk of isolation or loneliness. We also know marital status can be a factor, especially for those who have never been married, who are widowed or divorced. Those can increase the risk for an individual feeling those feelings of isolation and loneliness. Those that don't participate regularly in social groups such as a senior center or faith community, those that aren't connecting with others regularly, they have a higher risk as well of isolation and loneliness. And this kind of probably goes somewhat hand in hand with those who have fewer friends. Again, I mentioned earlier, those that have fewer confidants, those people that they can talk to, kind of their I would consider my best friends, those that don't have those kind of people in their life have a higher risk of isolation and loneliness. And we know that, life happens, and sometimes relationships get strained, and especially, family dynamics can come into play, and it can strain relationships for one reason or another. So those that have higher strained or have strained relationships might also feel isolated and lonely. And we see this especially in the LGBTQ population. A lot of times they might not have family to come around them in their older years. And then finally, a person's location can make an impact on isolation and loneliness. Those who are in more rural areas, maybe those who live in unsafe or inaccessible neighborhoods and communities, might find it more challenging to make regular connections, to get out of their homes, to safely get to social gatherings and that sort of thing. And then there's some additional risk factors. Those who are experiencing poor health or poor well-being can have a higher risk of isolation and loneliness. If you think about it, if you have any sort of mobility issue, it might impede your opportunities to get out and about, again, pre-COVID-19. So not being able to get out to those social engagements could increase the risk of isolation and loneliness. And then cognitive impairment. Those individuals who are first starting to notice their own cognitive decline, they might start to withdraw from social situations because they don't want others to notice their cognitive impairment, or they might feel that they can't keep up with conversation like they once were. So you might see an individual withdraw from social situations, or maybe their cognitive impairment keeps them from communicating clearly, and so they don't have as much communication as they once did. Or maybe they have to give up driving because of the progression of maybe dementia or Alzheimer's disease, and so they're not able to get to social outings. So this can be especially isolating. And then poor mental health. Depression has been linked with isolation and loneliness. And again, depression is not a normal part of aging, just like isolation and loneliness is not a normal part of aging, but it can increase a person's risk. And then communication barriers. A lot of people don't necessarily think about hearing loss. And if hearing loss goes untreated, they might not be able to engage in conversation. They might not hear it, and so they might be at a higher risk of isolation and loneliness. I even see this in one of my own aging loved ones at holiday gatherings. If this individual is not wearing their hearing aids, I notice that they do not engage in conversation as much. So, even something as simple as getting a well-fit hearing aid, or making an extra effort to make eye contact when you're speaking with the person can really help increase the opportunity for communication. And we do know that sometimes there are language barriers that could put an older adult at higher risk of isolation and loneliness. I know in my community, we're fortunate to have an intercultural senior center. And so there's individuals that speak, I think, upwards of 20 or 30 different languages, and they have a place to gather under kind of normal circumstances. And so that's a real asset to our community. But we know that those don't exist in every community. And then technology challenges. I think right now in this time where we're all socially distant, we're relying very heavily on technology to connect with our loved ones, our aging adults. Maybe if they're in a senior living community, we're using technology for FaceTime and Zoom and Google Hangouts. But we have to consider that not all older adults have access to technology or know how to utilize it. So that could be also a communication barrier. And then some more potential risk factors that we need to consider are major life changes. When you're leaving the workforce, retirement's usually a very happy occasion. But for some older adults, after kind of the happiness and the joy of retirement wears off, they're realizing that's where they had a lot of their social engagement throughout the day. So it's really important for individuals after they retire to find ways to continue those social outlets. Right now, so many of us are working from home, and we're not able to connect with our own coworkers on a regular basis, so that can make us feel isolated. I know me and my colleagues have a regular video chat every day just so we can see each other's faces and engage in a little bit of that office chatter that we would have if we were in person, and that really makes a big difference. So even you might be experiencing a little bit of that right now. And the loss of a spouse or a family member or friend, as you can imagine, can increase your risk for isolation and loneliness. And right now, people are losing loved ones and friends to COVID-19. And if you think about it, we don't have our traditional means of bereavement. We might not be able to attend a funeral or go to the burial site or do the visitation or to sit Shiva as we normally would. And so if someone is losing a loved one, it might put them at an even higher risk of loneliness. And so it's important to continue to find ways to reach out to those individuals. And also becoming a caregiver can be isolating, or it can increase a person's risk of isolation. I know we talk a lot about older adults and their risk of isolation, but family caregivers, it can be a lonely road at times. It can feel like you're in it all by yourself and that no one really understands. So it's important for family caregivers to connect with support groups or to find online communities where other caregivers are trading ideas or supporting and encouraging one another, because it can be isolating. And then also making a move, a physical move, can be isolating. If you think about it, pardon me, if you have always lived in a house and you're moving to a senior living community, you're moving to be closer to family, that might increase your risk of isolation and loneliness. So it's important to find ways to continue those social connections, even if you have physically moved away from where you have been. And then another set of risk factors are societal barriers. Right now, social distancing, people aren't able to be physically near each other, which can hinder our socialization. But again, we can be physically apart, but hopefully connecting socially in other ways. And even the good old-fashioned telephone works wonders in connecting with others. And there might also be a feeling that the older adult doesn't have a purpose or meaning. We all want to make a difference in the world, even if it's in small ways. So helping your older adult loved one find ways that they can still be engaged. Maybe right now it's writing thank you notes to healthcare workers who are on the front lines of COVID-19, or making masks and donating those cloth masks. Finding small ways, again, that they can continue to engage in society and make a contribution. That can be a great way to reduce the risk of isolation and loneliness. And then we know that another risk factor for isolation and loneliness can come in the form of prejudice and discrimination. We also know that lack of access and inequality might be an increased risk factor for isolation and loneliness. Those who are at or below the poverty line might not have the same access to services and supports, which could lead to isolation and loneliness. So then when we look at the impact that isolation and loneliness can have on the health of an older adult loved one, medical literature supports an overall linkage between between loneliness in older adults and declining health. Multiple research studies cite poor health outcomes that include an increased risk for heart disease and an increased risk for stroke. So someone might be at an increased risk of heart disease at about 29% and 32% for stroke. Also increased risk for developing dementia or cognitive impairment. One study, I thought this was interesting, they found that physical wounds on a person's body heals slower in those who are reporting higher rates of loneliness and isolation. Individuals also might have a greater perceived stress level and depression level if they are also isolated or lonely. And then poor sleep outcomes are a result of isolation and loneliness for some older adults. So again, it can have increased health risks in these areas, but it can also increase the risk of mortality. For some, isolation and loneliness is truly a life or death issue. A study found that mortality risks increase, and the increased risk for death for those who report that they are lonely is 26%. For those who report social isolation, they're at a higher risk of by 29%, and those who live alone, they have a higher risk, about 32%. So again, isolation and loneliness is not just impacting, your physical health, but it could also increase your risk of passing away before you normally would. So now that we've talked about the risks, let's talk about a little bit more about the impact of isolation and loneliness. Loneliness has an impact, as we just discussed, on a person's health and well-being, but it can also accelerate the aging process. IBM put out a really interesting report called Loneliness in the Aging Population. You can go to the IBM website and search for that, and it'll pop up. And again, it's called Loneliness and the Aging Population. But this report, it has several quotes from experts, and some are very well known in this aging space. And John, I'm going to mess his last name up here. I apologize. Casipio worked in the field of social neuroscience at the University of Chicago. He's since passed away, but he's very well known, and he and his colleague William Patrick stated in their book, chronic feelings of isolation can drive a cascade of physiological events that actually accelerates the aging process. So when we stop to think about that, being isolated can accelerate our rate of aging. So it's really, an important topic that we need to be communicating with families about. And I think we as a society, again, are kind of waking up even more so to this silent pandemic that's taking place. Another physician, Dr. Murthy, he was a Surgeon General here in the United States, and he said during his years of caring for patients, the most common pathology he saw was not heart disease or diabetes, it was loneliness. So I think that these two statements are very, very powerful, and it shows that the root cause of a person's health and wellness might not be really what we think it is. It might be tied to a person's ability to connect and to socially engage. But we also know that there is an economic impact to isolation and loneliness. People have actually tried to quantify this. So before COVID-19, older adults who are more lonely tended to make more medical visits when they weren't necessary, just for the socialization. And I've worked with healthcare providers over the years, and they fondly refer to these individuals as frequent flyers. So these individuals come into their office probably more than they should or they need to, just for the socialization aspect. And if you add up all the financial implications of isolation and loneliness, it's estimated to be about $6.7 billion spent by Medicare in relation to isolation and loneliness. So really this impact has a big dollar price tag attached to it. And the quote on the screen is again from the IBM report from George Cooks. He's a medical director of the UK National Health System, and he says, people will somaticize or convert anxiety into physical symptoms, which is their ticket to get in to see their family doctor. They actually don't have an underlying physical problem. They just want social contact. And so again, this I think speaks to our really innate desire to connect with others, and people will go as far as to visit their healthcare provider just to get that social interaction. And again, older adults often have very legitimate healthcare needs that they do need to see medical providers for. So I don't want to downplay that by any means. But again, a lot of them might see this as a social outlet. And right now, during COVID-19, people aren't able to access their healthcare providers like they once were able to. A lot of them are using telehealth to connect right now. And so again, we need to consider this as not only a physical and mental risk factor, but it also is costing our society a lot in terms of dollars amounts as well. But what I thought was really interesting is this IBM report laid out some problems that are occurring in our society. And it shows that there are many factors that contribute to this problem of isolation and loneliness. And it really centers around obstacles and a lack of effective solutions. So obstacles include things like a standard screening practice for isolation and loneliness. That really doesn't exist for us right now. Comorbidities, having multiple chronic conditions might make it difficult to detect isolation or loneliness. And there's still a stigma that surrounds isolation and loneliness. People don't want to admit that they're feeling lonely. They don't want to reach out for help. And then ineffective solutions or a lack of effective solution stems from an incomplete or ineffective stakeholder ecosystem and really a disconnect among all the solution points, and really also an inaccurate assumption of technology's impact. A lot of people think, well, if we get them set up with technology, it'll be able to help them connect more, but really is that the solution? So again, COVID-19 is really bringing all this to the forefront, and we're all talking a lot more about isolation and loneliness, and people are getting really creative in ways that they're connecting with their loved ones. And so hopefully we continue to see that as we all come out of this. And are able to kind of get back to our somewhat normal lives. So I wanted to just, before I pass it over to April, go over a few symptoms that we can pass along to family caregivers so they can keep an eye out on their loved one if they recognize any of these symptoms to direct this individual to their healthcare provider, or to find creative solutions to engage their loved one and reduce the risk of isolation and loneliness. So when we think of symptoms, I've kind of bucketed them, so hopefully it's a little more digestible for you all. But, physical symptoms can manifest in terms of aches and pains and muscle tension and frequent headaches and illnesses or worsening of medical conditions. We also see mental health conditions that can be symptoms of isolation and loneliness. So an increased risk of depression, drastic mood changes, anxiety, paranoia, panic attacks, all of those, again, would be something for family caregivers to look out for. A few more symptoms include low energy, being tired all the time, a lack of motivation, kind of having that brain fog. Maybe they're not eating enough, and so they have a little brain fog. And sleep issues, difficulty getting to sleep, waking up frequently throughout the night, having trouble staying asleep or sleeping too much. Maybe they're napping more throughout the day because they don't have anything to do. And so they don't have that social engagement. And so they're taking more frequent naps. And then some final symptoms to be on the lookout for would be maybe dietary issues, loss of appetite, a sudden weight gain or sudden weight loss. We know that companionship at mealtime helps older adults eat more. And so if they don't have anyone to share meals with, or maybe they're not getting as much social engagement, they might not be getting as the needed nutrition. And so that might be an issue. Also, substance abuse, increased consumption of alcohol and smoking, medication and prescription drug use. I think some people are joking about how people are drinking more during this time of social distancing, but it can become a real issue for some people, especially those who have had past issues. Maybe they've been in recovery, but, isolation and loneliness can draw that out. And then negative feelings, feelings of worthlessness, hopelessness, even thoughts of suicide. And I know suicide's never an easy thing to talk about, especially for some reason when we talk about the older adult population, suicide really doesn't get brought up much. But those are all symptoms of isolation and loneliness. So again, if any of you as professionals or the family caregivers you're working with notice these signs and symptoms, it's time to work on solutions and getting medical professional involved and finding ways that the adult likes to engage and encouraging those opportunities for social engagement. So a few last warning signs here. I've talked about a lot of them already, but did just want to point out a couple more. Changes in appearance. If somebody used to be very well kept and all of a sudden they're having issues with personal hygiene or daily grooming, that might be a sign of isolation and loneliness. Transportation issues, this is probably more pertinent pre-COVID-19. No one's really going many places right now, but maybe they're having difficulties driving at night or in inclement weather and they need alternate transportation solutions, or maybe they have a lack of transportation altogether. And then also you can look for clues in their environment, spoiled food in the refrigerator that's not getting open. That might be a sign. If they used to have an immaculate house and all of a sudden it's a little bit in disarray, also might be a warning sign, and same with missed medications. So again, those are some warning signs that people can look out for. But the most important thing is those interventions, how to approach the topic with the individual and to kind of move things forward. And to talk to us more about that, I'm going to pass that over to April. So April, I'll let you take it from here. And thanks so much for joining me today.
Excellent. Thank you. And just to verify, you can hear me?
Yes, I can hear you.
Excellent. Yes. Well, gosh, I know that was really a lot of information and a lot of news or facts that's kind of hard to take, because I was sitting here thinking I see myself in so many of those statistics and those risk factors. This topic of isolation and loneliness has started way before COVID. And now we're all impacted, not just the elderly, but everyone. So it's a good time to kind of open up the discussion with older adults or family members, because we can also share our own concerns, our own feelings. We have to remember, though, when approaching this topic, that there still is a stigma. And I think, everything, let's face it, everything is going to look different in the world from here on out. But there is still, or always probably will be, a little bit of a stigma associated with loneliness. So I think if we kind of gear towards talking more about social connections rather than loneliness when confronting the problem, it sort of makes it a little bit easier to talk about. And what we don't want people to feel is that in some way that they're a social failure if they feel lonely or if they feel disconnected. So in like every difficult conversation we might have with an aging loved one, we have to remember that it's not always easy to bring these topics up, and they may not be readily prepared to talk about it. But again, I think we can bring now our own experiences to the table and have these conversations much easier. There are some assessments available. The short scale for measuring loneliness really is just asking a couple of questions. Because again, keeping in mind, people probably aren't going to feel like they need an assessment, but you can weave these questions into everyday conversations. How often do you feel that you lack companionship? How often do you feel left out? Do you feel isolated? And let's face it, if it's our own family members, we can observe this. We can see this. AARP has a great resource, and it's called Connect to Effect, and they have an online assessment. So there are some great tools out there to get this conversation going. Additionally, this is a great online assessment that's offered by N4A, the National Association of AAAs, is a good brochure and assessment tool. But as you're trying to have these conversations, whether you're coaching your family caregivers or you're dealing with clients yourself, like everything else, we have to be respectful with how we broach these subjects, and make sure that we're keeping, what's the goal of that person in mind. And we have to be patient. Bringing up a subject like loneliness, we're not going to make big changes in one day. Right? We have to be patient and start these conversations gradually. I think in anything we're trying to do for our aging loved ones, it's starting the conversation, planting the seed, and moving it forward to the best outcome available. So we have to be patient, and we have to be respectful of their wishes, of their needs, and making suggestions as we go along. Having good, clear communication and acknowledging their own fears. I think it's very common that we kind of push our own agenda or our own fears onto older adults when it may not be the case for them. So let's be respectful and acknowledge their own fears and concerns. Keep things in perspective. How important is this? Because, what we're going to realize is there's so many different phases or ways that people feel isolated and lonely. And there's a lot of different simple approaches that we can take. So let's, again, keep it in perspective, let go of things that don't really matter, and don't get into a power struggle about some of those things. And I think the best place to start really is to address the barriers. And Lakelyn did a great job of kind of talking about what are some of the barriers. Because as we look at, somebody that we may be concerned about, we know that a connection can reduce their risk of early mortality. And let's face it, we're talking about this now because this is becoming a health issue. We're talking about this because older adults are not the only ones who are going to be impacted by isolation and loneliness. This is a new world for all of us. So we have to look at, what is the baseline for this person, right? Where were they before there was an issue? What are the barriers, and how do we get them to having a greater connection somehow? And I think that is so important. We went through the barriers already. Again, in a pre-COVID world, when you talk about transportation, what's the worst thing that can happen to someone as they age is traditionally to have their license taken away from them. Changes everything. No longer do they have the freedom and the independence to just go to the grocery, go to the shopping, do whatever it is they want to do. So that could be one of the things that started this transition to having that person be more isolated. And I think we way underestimate the hearing and the vision loss. I mean, I personally don't see very well. I find myself not wanting to drive at night, I prefer to walk places or take a cab if I'm in a different location. So, those two things alone can really be a big barrier. So addressing those and making sure that's not a problem. How do we remove those barriers? Easy enough. Let's talk about hearing aids. Let's talk about helping the vision. Mobility. Of course. I mean, how many times have you seen older adults trying to get to the doctor's office, right, which could be their socialization, and it takes them all day. I saw this with my own mother, to get in the car, get there. It's exhausting. So if you're having trouble getting around, of course it's going to be a barrier to getting out and about. Depression, I mean, I have experience with depression. I'm sure probably everybody on this call has or knows someone. When you are depressed, there is no appetite for anything. And that really is, an issue that has to be addressed in order to get these folks to engage more. The mismatched environment. Again, I think about somebody who's aged in their home for 50 years. Now they're in a either rural area or an area that's very unsafe, or they're very disconnected from anybody around them. There's no way that they can get places. Having that wrong environment, again, is that a barrier? How do we fix that? And if they're a caregiver and they don't have sufficient support, to get out and to enjoy things that they used to. How can we, how can they be happy and engaged if they can't get out and about to do the things, whatever those things are that they used to love? And that takes me to, talking about the individualized approach. And I think this is what's most important because, we tend to put seniors in a category, right? Seniors play bingo. Seniors do this. Seniors love their grandparents. We don't know. Everyone is very different. And again, I think it comes down to finding that baseline. What was this person like before? If you have identified that somebody, they're isolated, they're lonely, you see all of these things in their appearance and their attitude, and there's a problem. Well, what were they like before? And we have to start with that because, I can use my own mother as an example. She was never what I would call a joiner. She was not comfortable in social situations. She did not join clubs and groups, but she was a career waitress. And that was how she engaged with people, and she thrived on that. And when she physically could no longer do that, she retired. And, what she replaced work with was shopping. And she would go out, and her day, her connection, her meaning came from talking to people at Chico's, at the bakery, at Macy's. And that was how she engaged. She wasn't very good at personal relationships, but that was enough to feed her. So we have to remember, not everyone is alike. What is a meaningful connection? And I think it was, when Lakelyn referenced, people can still be lonely when they're surrounded by people. And I don't mind being alone. But again, if you have meaningful connections, you're not going to feel that isolation. So what is it that person needs? Who are they? Sitting on the front porch, waving to neighbors. I mean, I used to have neighbors who lived across from me, and the older man was always in his lawn chair on the driveway, and that was how he engaged. That made him happy. Going to the bank every day for some people. You may think, God, Dad, you could do that online. Why are you going out? That was connection for that person. I was a waitress when I was in high school, and there was always a group of older men who came in and they drank coffee all day long. They would sit at the counter and talk. And guess what? Now I get it. They were there to connect. They were retirees who would meet for coffee every morning, catch up, and get their connection and feel good about it. If we try to take somebody and mismatch them and say, I really think you should join the senior center, or you should go to this club, or you should do this, or you should do that. If we mismatch them and try to place them in a situation that we think is good, but they feel it's like, this is not me, that could be more harmful. Not everybody is an extrovert. Not everybody can benefit from being in some sort of group. So we have to remember, what is it that they need? Look at that individual and say, ever since Mom died, I feel like you're more lonely. Well, of course he's more lonely. So what would it take to have a conversation about that and help that person find a replacement or a way to connect? I read a fabulous book recently by Elizabeth Berg, who this older gentleman went to the cemetery every day to visit his wife who had passed a year ago. And he met a young woman there who was in her teens, and she was being bullied at school. And they became very close friends. And it was just a fabulous story. She moved in with this gentleman, and there was another lonely neighbor next door. So just remember that what people need is individual. And we can't just put a solution that we think is right. We need to target it based on what is important to them. It's not quality. It's not quantity over quality. It's really just meaningful conversations. There are a lot of resources available, and keeping in mind everyone's different. Not everybody's going to go to the senior center, and I think they're great places, but not everybody is comfortable with that. And I'll be interested to see what that environment looks like, say, 5 or 10 years from now as the baby boomers continue to age. Fitness centers are a great place. What better to stay healthy and engage? For 10 years, I taught the retirees of General Electric. I taught a fitness class 3 times a week. I had about 50 retirees who would come for that program. That was social connection for them. It was very meaningful. Adult day programs where people can go and get some respite for the family and get services. PACE programs, which is the all-inclusive care for the elderly, hiring a companion service, a home care, somebody to come in and help around the house, but also provide that connection. We know that for many older adults, faith-based organizations and programs and teaching a Bible school and those types of things and joining there are very, very helpful. And I think it's worth mentioning that employment is still a good option. You know, AARP is doing some great things with the older workforce. And I don't think everybody necessarily should always retire. I plan on transitioning into something that I would love more. What gives people more meaning and purpose than staying employed? So I think that's a great way for people to stay engaged. And of course, volunteering too, finding the right place where you feel like you're giving back. You have a purpose every day to get up, get dressed, and do things. At Home Instead, we have an initiative that is very cool. It's called Ready to Care. Here's some information on that. And it's basically a movement to make the world a better place for seniors. And everything that we're talking about, let's face it, you know, a simple phone call to somebody can lift their day. Cards, letters, including them in on you know, things that you're doing with your own family. You know, there's just a lot of ways that we can make a difference that is very, you know, simple and easy to implement. And there's also some other great initiatives out that I have found. I've just referenced a few of them. And I think it's important to recognize that everybody on this call has an opportunity to do something. You may do something personally. You may do something with your own family. You may recognize you need to reach out to more people. You may want those connections. You may need them back yourself. You may want to start something in your own community if there's a need. But some of the really cool programs that I found include Care More Togetherness program, which is really a kind of a clinical-based program. And what I like about it is now we're getting a lot of attention on this subject because it is a health issue. And anytime it's costing healthcare something, we're going to pay attention, right? Many of you probably remember years ago there was a big trend in population health. We were looking at, if we're going to treat the individual, we have to treat the whole person, the holistic approach, and looking at what are the barriers for them to get what they need. And it's not just treating the diabetes, it's treating the nutrition, it's treating, you know, everything about that. So Care More Togetherness actually is a really neat program that is a kind of a healthcare-based program, and they do a lot of phone calls and virtual programs, and they have found some really good results. Intergenerational solutions, I think, is fascinating. Again, more people, seniors living with younger people living into some retirement communities, ways that we can bridge housing and issues around housing and financing for young people and loneliness for older people. There's some really interesting things going on in that space. Senior center without walls. Not everybody wants to go to a senior center. How do we take the walls down and have more programming that seniors can access online or, you know, through travel? Daily call sheet is a really interesting one that was actually, this one was set up through the motion picture television funds, which I thought was interesting. And it's really about calling people, reaching out to them. We can all do that. Love for the Elderly is an amazing program. It's a young man who his grandfather passed, and he started this program where he encourages people to send letters that he can send to individuals in a nursing home. Human Loneliness Kit, I believe that is something that Humana has put together. It's a great real resource. There's a coalition to end social isolation and loneliness. There's friendship lines, phone calls. Again, there's a lot of new things. I encourage you to ask, what can you do? What can your organization do? What can you do as an individual? And know that there is legislation. This topic is not, and again, this was all pre-COVID. Imagine what it's going to look like afterwards. This is a subject that's not going to just wither away. It's going to become vitally a part of everything that we do. I'm not a politician. I'm not big on legislation, but I found these two. I think they're interesting to check out and know that we're taking a look at, how important this subject is and what we can do to provide resources. And of course, Mother Teresa knew this a long time ago. The only cure for loneliness, despair, and hopelessness is love. We all have a lot of love that we can give, and I think there's so many things that we can do. We want you to be inspired about this topic. We want you to get excited about it. I know there's a lot of things that are, it's heartbreaking in a way, but all of our hearts are breaking, and this is the time to really do something different. And I encourage you all to get creative. And with that, we're running a little bit late. I will open it up for Steve for questions.
All right. Thank you very much, Lakelyn and April. Lots of really great information on a very important topic. So I want to thank you for joining us here today. Everyone, it is time for Q&A portion, so send in your questions if you would like to. Now is the time to do so. And April and Lakelyn will jump into it here very quickly. The first question for you: how to deal with individuals who prefer isolation due to Alzheimer's?
That's a good question. Prefer isolation due to Alzheimer's. So, April, are you okay if I take this one?
Yeah, go ahead. Yeah, please.
Okay. So my first thoughts, and maybe April, you can add to this, is, some individuals who have Alzheimer's disease, it really kind of depends on, the stage of the disease that they're in, and also their personality type. For some people, their personality changes as the disease progresses, and some people's personalities stay somewhat the same, but their cognitive abilities are declining. So if somebody, has been kind of more of an introvert their whole lives, they haven't had a lot of social engagement, and then they develop Alzheimer's disease or dementia, they might continue to have that desire to be more introverted as they progress through the disease. For some, overstimulation as the disease progresses, as Alzheimer's or dementia progresses, a lot of stimulation and social engagement becomes overwhelming for them. And so sometimes they might have a dementia-related behavior because they're feeling overwhelmed. It might result in things like agitation or aggression or a few other dementia-related behaviors. So when we teach our caregivers at home instead about Alzheimer's and dementia, we talk about how personalized the care approach really needs to be. There's this term person-centered care in the dementia care space because each person with dementia is impacted differently. So the saying is, if you've seen one person with dementia, you've seen one person. So you really do need to get to know the individual, and that's why what April said about making sure the match is good between getting them engaged socially and making sure it's a good match for them as in terms of their personality and their abilities. For an individual who might prefer to be more physically isolated, again, that might work for them. It might be comforting to them, but there's still ways you can have them be engaged, and it's really important to find meaningful opportunities for them to engage. So maybe they like to read, and as their dementia progresses, maybe they don't have the ability to read anymore. So maybe you adapt that and find books on tape or something of that nature, or maybe you find books with a more simple plot line, or so again, kind of adapting it to meet the individual where they're at. But I think that brings up a good question, because for some people, they're not going to want to have a lot of social engagement. So again, it's really getting to know the individual with dementia and getting to know their preferences, and maybe, writing letters to that individual is more comforting, knowing that they have social engagements, or having grandkids draw pictures and delivering those instead of going and visiting. You might just have to kind of adapt the approach. And with dementia, a lot of times it's kind of trial and error. Try it, and if it doesn't work, it might just be that it won't work that day. Maybe you try it another time. And if it doesn't work on a couple different occasions, maybe you scrap that and try something new. And you might have something that's been working for days, weeks, months, years, and all of a sudden the individual isn't up for it that day. And you realize that's really okay. It's meeting them where they're at. And I think that applies really to all older adults, is, meeting them where they're at, getting to know their preferences, as April mentioned, and finding things that are going to be meaningful to them. Because if it's not meaningful to them, then it's not going to bring value, to bring joy, to bring, connectedness to their life. So thank you for that question. Steve, do you have any other questions for us? You might be on mute, perhaps.
Yes, it helps when you take yourself off mute. So the question is, what are effective ways to connect with older adults who are experiencing communication barriers, such as hearing, language, or technology?
Another good question. April, do you want to take a first stab, or I can jump in?
Sure, go ahead. Yeah, that's fine. Go ahead.
Yeah, so, language barriers are challenging. And, when you think about, communication challenges, it's finding a way to communicate. And maybe it's you're working with an older adult who doesn't speak the same language as you. One thing that I think we all connect through is music, so that might be a fun way to engage with them, is through music, or Google Translator. I know I've used that on several occasions. You can type a phrase in and it can translate it, and so that might be helpful. And there's some programs within the community that has programming for older adults in other languages. I know I referenced, we have an intercultural senior center in our community, so you might look for outlets such as that. For hearing barriers, we talked about making sure that they have a properly fitting hearing aid, and then also just doing little things like making sure you make eye contact with them, and you make sure that you're not talking to them from behind. You make sure you get in front of them so they know, yes, I'm talking to you and I want to hear what you have to say. For individuals living with dementia, I know sometimes it just helps to ask a question and then pause. And sometimes that pause might feel like eternity to you, but it's allowing the individual to process your question, to formulate a response, and to speak that response out. So for someone with normal cognition, quote unquote normal, that might be a quick process. But for someone with cognitive impairment, it might just take a little longer. And I forgot what the last one was. It was language. Was it hearing? Steve, what was the last? Technology. April, do you want to take that one?
Yeah.
You just did a webinar on technology not too long ago.
Yeah. Can you put the whole question together again for me? I was just looking through all these.
Sure. What are effective ways to connect with older adults who are experiencing communication barriers, such as technology?
Okay. Well, yeah, access to technology is always an issue. And when we talked about technology in the previous presentation, recognizing that some people don't have internet connections, some people don't have devices, I think it's important that we always come down to the most simplest way to connect with people, which is to reach out to them and have a conversation, right? So you can still phone. You can still write letters. You can do all the basic things, using what is available. And, technology helps, especially now when you could do like the video things, like tools like the GrandPad or Zoom or other ways that you can do that. But it's a little bit more of a challenge now because, we weren't set up for this before. So how do we get, our loved ones connected with technology in the middle of this crisis when we can't necessarily be with them? So I think we've got a lot of learnings from this crisis and how we can be more proactive and prepared. And that's a great way to have these conversations is, Mom, Dad, I don't want to be without communicating with you. Are you willing to take this device so that we can better communicate when we can't be together?
Okay. Well, Lakelyn and April, unfortunately, we've reached the end of our hour here, and it's time for us to wrap up. But I want to thank you for joining us for a super important presentation today with a lot of great information. Thank you so much.
Thank you. Thanks, everyone.
Thank
Have
you.
a great rest of the day.
Thanks, everyone.